Those of you who have seen me as a chiropractor, you know that one of the main things that I always focus on with a new patient is to look at the structure of the feet. And the reason that I look at the feet is because the feet are the foundation of the body and provide biomechanical support for everything else that happens in the body. So when the feet go out of balance, the most common type of foot imbalance is called foot pronation. Foot pronation is where if my hand were the arch of the foot and this were the medial arch of the foot, it means that that arch is falling. And as the arch falls, the foot rolls inward. And as it rolls inward, it then causes the knees to roll inward, the hips then roll inward, the pelvis tilts, causing us to sway our back and then bring our head forward. If one side rolls in more than the other, then the pelvis will drop down on one side and create imbalance in the whole spinal structure. So then we have to curve back. So you'll see a person with a high shoulder and low hip, these types of things. Now the question that I wanted to go over today, we'll talk about the posture a little bit later in another video, but today I want to talk about the different kinds of orthotics that we use in terms of balancing the feet, because many times patients come in and they go, but I've already got orthotics. I'm wearing orthotics. The podiatrist gave me orthotics. The orthopedist gave me orthotics, or they went down to one of these fancy shoe stores that are available today and got some orthotics. And they want to know why the orthotics that we use are different. The orthotics that we use are made by a company called Footlevelers, which has been around for a very, very long time. They've been around a long time when I started practice, and that's over 30 years ago. And it's a chiropractic company, and one of our understandings of the feet is that if you look at the structure of the foot actually has three arches. So it doesn't just have an internal arch like I was showing you here, but it has an arch on the outside of the foot and actually an arch that would be underneath the toes, like that. So three arches, one on the inside, one on the outside, one across the bottom of the toes, or right underneath what are called the metatarsals. And those three arches provide a tripod kind of support system for the foot. Now, if you look at an orthotic from any other source, most of the time, I would say 90% of the time, those orthotics have one arch, and that's the internal arch, the medial arch it's called. And they're supporting the medial arch only. Sometimes I've seen them with a metatarsal arch, the one in the front, but most often it's just a medial arch. I don't think I've ever seen one with all three. There might be one out there, but I haven't seen it. So what happens when you jack up one arch of the foot without doing anything to balance the overall structure of the foot is like jacking up one leg of a chair. And when you do that, you throw off the proper biomechanics of the foot. The other thing that happens in most orthotics that are not coming from Footlevelers is that they make the orthotic hard or rigid. They're made of some sort of acrylic material. When you make an acrylic orthotic and you look at the way the foot moves, the foot should be moving like this as you're walking, but instead it begins to move like this because it's got this rigid support under it. So what happens is then that lack of motion in the foot has to be taken up by the ankle, the knee, the hip, and it creates other problems up the chain, up what's called the kinetic chain. And that disturbs the whole biomechanics. It disturbs the way the timing and the gait, the timing of the muscles firing. It creates instability most often in the sacroiliac joint, which is this low back area to this right away from the center of the body in the upper pelvis area. It's the most common area to hurt. And so the foot pronation itself creates that stress, but also improper orthotics create that stress. So when patients ask me, but why doesn't the orthotic that I have work? I have to explain to them this mechanics of the different types of orthotics. I like to say the word orthotic is like saying car. You say, I have a car. That doesn't tell me very much. It tells me you've got a vehicle. It may have 4 wheels. It may have 3 wheels. It may be a Maserati, and it might be a Volkswagen. It could be anything. It could be a Humvee. So the word car doesn't mean much. The word orthotic doesn't mean much either. It's just a term. There are many different kinds of orthotics that are used for different reasons. And you might ask, well, why don't all orthotics function like this one that I'm talking about? that chiropractors use. And the reason is that different practitioners have different purposes. In podiatry, they're using the orthotic to treat some foot disease. Usually that orthotic is actually acting more like a splint and keeping the foot rigid to stop the pain in the foot. And there's a time and a place for that type of orthotic. But when we're trying to balance the biomechanics of the body, if we're trying to, for instance, function by treating a headache by correcting the feet, which is my experience when I first went to a chiropractor, he told me my feet were flat and that my headaches would go away when I started wearing orthotics. I thought he was crazy, but when I put the orthotics in, my headaches went away. And to have that kind of effect, you have to use an orthotic that's balancing all the biomechanics of the body, which is what we use. So for those of you who've had that question, I hope this is helpful. And if you have any other questions about orthotics or about the balance of the feet, how it affects posture, then just let me know. Thank you.